Welcome to Pulse Check, Wisconsin. Good morning, good afternoon, good evening, whatever it may be for you. This is Chris Ford again for Pulse Check, Wisconsin. For those who are just now picking up the podcast or are new to the podcast, I'm an emergency medicine doctor here in the city of Milwaukee, and I practice kind of all throughout the state of Wisconsin as well. But I want to thank you for joining us here today. First things first, I want to do a little bit of housekeeping. I want to thank everyone for listening up through this now fourth episode here. I can't thank you enough for listening. I can't thank you enough for your feedback. We've got a lot of good feedback over the course of the first couple episodes. And, I want to thank you for making us, now one of the fastest growing healthcare podcasts in the state of Wisconsin. We have had some very great guests on with us who have covered a wide breadth of information about substance abuse treatment therapies, about the pandemic, kind of the intergovernmental workings of medicine, and touching on those social determinants of health as well, which we set out as our goal for this podcast initially. And so we're going to continue on with that same course. Today is a special episode. And so we're going to break up some of the episodes into some of these special edition episodes as well, where we are going to kind of focus in on a specific topic. So today there won't be a case as we typically will do, but what we'll do is we are going to touch on one of the issues that's affecting our state here in Wisconsin as well as throughout the country, and that is the nursing shortage that we are have experienced over the last couple of years, and estimated to increase in its severity over the next several years. And so, just to kind of give you some background about that, what we want to do is we want to, of course, retain the absolute most nurses that we can here in the state of Wisconsin. Over the last several years, what we've seen in the emergency departments, kind of pre-COVID as well as post-COVID, we've seen boarding in the emergency department. And what boarding is essentially when you have a patient who is in the emergency department after the patient has been admitted or placed into observational status at the facility, but has not transferred to an inpatient or to an observational unit. And so that patient essentially is held in the emergency department. Many emergency departments throughout the country, as I said before, have experienced this kind of critical overcrowding and heavy emergency resource demand over the last several years. During the pandemic, we saw a large number of our nursing staff dwindle, either secondary to burnout or secondary to being lost to travel contracts to other states. Here in the state of Wisconsin, we were really hit hard. I know my hospital, the hospitals that I worked at, were hit hard, as well as my colleagues throughout the state as well. So no one was safe from this epidemic of loss of nurses. And so, to be honest, there's multifactorial reasons as to why we're experiencing this shortage. I know a lot of friends of mine, a lot of colleagues of mine who have nursing backgrounds will kind of attest to this and tell you that, some of it has to do with some of the ratios that they experience. But what I mean by ratios, meaning how many patients they're being forced to carry during a shift secondary to those shortages. And again, that's not something that is unique to the state of Wisconsin. I have colleagues of mine who've worked down, in Florida or Pennsylvania, Ohio, Texas, in which their ratios for one nurse for, 4 patients, which is the norm, has been extended to 1 nurse for every 8 patients or 10. And in those situations, you get that overcrowding, which is something that creeps up. And because of that, we have more and more patients that stack up in the emergency departments and patients that aren't able to go to the floors because, again, the floors too are being strapped with the number of providers, the number of nurses that are there as well. And so it's something that I wanted to focus on because it's something that is going to affect your day to day. And I wanted to give you a little bit of background into why your wait times in the emergency department may be so high, and talk about some of the things that we are doing in order to alleviate that. We're all working at the ground level and as well as the policy level to try to alleviate some of the stresses that are placed on the emergency department and the hospitals due to shortages and due to boarding. One measure that we're seeing here in the state of Wisconsin is a task force which has been developed. It's a healthcare task force in order to address the nursing shortage. We're estimated to have a deficit in the upcoming years of about 20,000 nurses here in the state of Wisconsin. And so our governor here in the state of Wisconsin initiated an executive order in January of 2024 in which he placed our lieutenant governor, Sarah Rodriguez, in charge of spearheading this task force in order to promote a retention of nursing in the state of Wisconsin, as well as to facilitate a pathway into the nursing field to remedy this issue as best we can. The task force, as we'll discuss a little bit more, has folks from all over the allied healthcare profession. We have, chief executives, we have doctors, we have nursing staff, a host of people that are coming from all over in order to help retain our vital nursing staff here in the state of Wisconsin. And so with that being said, what we will do is we will introduce our guest. You don't need to hear it from me. I want you to hear it from the source directly. And so our next guest is a former educator here in the state of Wisconsin, a Wisconsin lifer. And in looking at the bio that I have in front of me, it looks like he is a bobblehead enthusiast, which I did not get a chance to ask him about. But I'll promise, when we have him on in the future, hopefully we can ask him about that specifically a little bit more. So with that being said, I won't waste any more time. I'd like to introduce you to the 46th governor of the state of Wisconsin, Governor Tony Evers. All right. Well, again, thank you, Governor Evers, for being here with us. It's a bit off topic, but as we were talking about before, I want to thank you personally for your role in securing fair maps in the state of Wisconsin for the first time in over a decade.
Yeah, the people of Wisconsin will have a better way to interact with government and making decisions, and so that's what it's all about, frankly. So thank you.
Absolutely. Well, I know you got a tight time frame here, so we'll go ahead and get to the chase here. In the beginning of the intro, what we did was we talked about some of the nursing shortage in the state of Wisconsin, and I just wanted to read off some of the statistics here. But according to the recent data that we have, it's estimated to be a shortage of about 20,000 nurses by 2040 here in the state of Wisconsin. And as we've seen, with our recent nursing shortage, it would be devastating for a strained already essential workforce. In order to combat this, it looks like as of January, you signed an executive order to create a task force on the healthcare workforce. So I just wanted to reach out and see if you can expound on what the role of this task force would be and how that would garner more nurses here in the state of Wisconsin.
Yeah, and we have both DHS Secretary Kirsten Johnson as part of that, and Amy Pahacek from the Department of Workforce Development. They're serving as co-chairs of that. And we anticipate that this group will be able to meet with folks because it's a good working group. We have nurses on it. We have EMS folks on it, community health folks, you name it. So it's a good purpose. But I can also tell you, bringing this out and starting this workforce task force is really, really important. Healthcare task force. Because I've seen results already. I visited, I think, probably 5 or 6 areas of the state where the technical colleges and the UW system are working together. I'll use La Crosse as an example. They've really ramped it up. They have a good the technical college. They're working with UWL and they're starting new classes of nursing like every 6 months instead of once a year. So they're like doubling the numbers already. So I think, is this going to solve everything in a quick way? We're an aging population. There's going to be nurses that are aging out too. So having this good start is important, but we have the right people together already, and on the task force, they're doing good work. I was talking to the lieutenant governor this morning about that. But I also think that just having this discussion has caused the technical colleges and the universities working together in a really interesting way, like UW Stevens Point and North Central Technical College. They've put together a 4-year program. The first years at the university, 2 years of at the technical college, and they're ready to go out and work right then if they want to. But then they can either go into the workforce, which many are going to be doing that right away, and then coming back for that last year. So there's all sorts of really good, thoughtful things that are happening across the state. So I think we're headed in the right direction, but we have a long way to go.
Yeah, I agree. And, just speaking as a healthcare professional, especially during the pandemic, it was devastating the amount of nursing shortage that we had. We lost a lot of nurses across state lines as well with the travel nursing. And so I agree with you. I think it kind of, goes hand in hand with some of our boarding crisis issues that we have throughout the country, not just in the state of Wisconsin, but also felt here as well.
Yeah, absolutely. And you bring up a good point there. We have DACA folks here in the state of Wisconsin that could really help us. There already are physicians or nurses or other trained professionals in the healthcare world that, because of their DACA status, it's not happening. We're working to find, we try to get some legislation through last session. It didn't work. We're trying to see if there's other ways to get them licensed, but we're going to do everything we can. I mean, this is a, you think about how it's relatively stable the healthcare industry has been over the years, and now we have a situation in Eau Claire where I have 2 hospitals going belly up and closing their doors quickly, and so there's a lot of people that are now finding other jobs, obviously, but the systems themselves are struggling, and one of the biggest struggles, obviously, is having the appropriate number of people there.
Yeah. And one of the things that you mentioned too was Lieutenant Governor Sarah Rodriguez will be leading this task force. And for those who aren't familiar with her background, she has a background in public health and healthcare administration, as well as a nursing background at the ground level. I think that having her, helming the ship is going to go a long way, looking at this issue from a multitude of different perspectives, and again, hoping to garner some results in going forward.
Yeah, absolutely. She's obviously, her background is perfect for this task, and I feel positive, but it's just 20,000 is 20,000. That's a lot of folks, and so having the start that we've had is good, but we're going to have to find ways to, and we also have to find ways to bring back the traveling nurses that you mentioned. That clearly finances played a role in that, and so hopefully we can find the resources to make sure that people are paid a good wage here, so that they don't become traveling nurses to Texas. We want them to
exactly.
We want them to work here.
Right. Have there been any legislative barriers to addressing this shortage in recent months?
Yeah, well, the last budget was not particularly helpful, and I'll use the DACA as an example. Legislature has difficulties understanding how important those young people are to our economy, but we got zero help on that, and so I think people understand the differences, but sometimes it's hard. Sometimes it takes two or three efforts to convince them of it. So we'll keep trying. I mean, we have the money. We have a good surplus in the state of Wisconsin. So hopefully we can get the legislature behind us on this. The Republicans and the Republicans in general. And to be frank with you, the fair maps will help us.
Yeah, and in upcoming episodes, I'm going to highlight some of how representation in the fair maps and how that actually feeds into not only your day-to-day, but into your healthcare. That's one of the reasons why I get involved with trying to promote fair maps as well. But a lot of folks understand how those things go together, and again, it kind of emphasizes the importance of your passage of fair maps and how that will hopefully down the road affect the folks of the state of Wisconsin.
Absolutely. If you have competitive races and people have to lay it out to people that are voting for them, and healthcare will be obviously one of those issues. So yes, that will be on the agenda for people all across the state. If they want better healthcare, we need to make sure that the people that are sent to Madison are ready to do that good work.
One of the things that you mentioned too was the nurse apprenticeship initiative that was developed in partnership with the University of Wisconsin Green Bay. And the goal was to train over 10,000 certified direct care professionals. Through that program, and as you said, there was a couple of community available programs as well. What are the goals for that other than kind of increasing the amount of nursing students? And will there be any kind of reciprocity between any of the healthcare companies in the state of Wisconsin?
Yeah, we have to get them involved. In fact, I'm right after we're done here, I'm going over to talk to the folks at the Hospital Association and encourage them to work together on this issue. Obviously, taking a nurse from one system to another and paying them more, and that movement doesn't help. Frankly, we need a statewide approach to this, and so I'll be encouraging them as leaders in the healthcare industry to kind of get behind this also.
Absolutely. Well, Governor, I know you have to run to another interview, and I want to thank you again personally for taking the time out here today. I think it'll go a long way in helping folks understand the shortage that we're up against. Any advice for folks who want to get into these programs, or advice for anyone who wants to help out with this shortage in general?
Yeah, I would make sure that if anybody's interested in it, that they follow the work of that task force, and contacting directly the lieutenant governor or the Department of Health Services. I think that work and the work that will come out of that, if people have questions and want to be involved, that'd be the place to go.
Awesome. Well, thank you, Governor Evers. I appreciate your time, and thank you so much as always.
All right. Thanks a lot, Dr. Ford, and keep up the good work.
Thank you, my friend.
Yeah. Bye-bye.
I wanted to share a story that is present on the ACEP website. So ACEP is one of our national governing bodies in emergency medicine. It stands for the American Colleges of Emergency Physicians, who have been very vocal and have been steadfast advocates in addressing some of the nursing shortage issues that we're experiencing as a country at a federal level as well as a state level, and has also been instrumental in creating a soundboard for healthcare professionals and emergency physicians to speak on some of the issues that they're having in their emergency departments throughout the pandemic and currently. It should be known that as of the beginning of this year, roughly around 90% of emergency departments throughout the country are experiencing some form of boarding. And a lot of it has to do with some of the nursing shortages as well, and some of the bed shortages that we have at the admission side. And so I wanted to speak on a story that is posted to the ACEP website. I'll link that as well if you guys want to take a look at it. But it is an amalgam of cases and testimonies that were collected from a lot of physicians throughout the state, throughout the country, that spoke on some of the emergency department boarding stories and some of their experiences. So the name of the story is Not Safe, and it is written from the perspective of an ER doctor who has been working for many years in the emergency department and is seeing some changes that are affecting the care of the patients due to some of the boarding issues. So it goes, I'm a steady nighttime ED doc for many years now. I work in a 34-bed ED. At night, we normally staff enough nurses, a PA or a nurse practitioner, and myself for 20 patients. We calculate one nurse to 4 patients. Unfortunately, over the past year or more, we have had nights where we hold 20 or more patients in the ED waiting for beds. Some are ICU patients. In the unit, they will normally have one nurse to 1 or 2 patients. Our nurses will have 1 or more sick patients that take lots of work and at least 3 other patients. Some nights, 7 patients to 1 nurse. This is not safe. So I wanted to highlight that story to sort of typify what is going on in real-time emergency departments throughout the country and some ERs here in the state of Wisconsin as well, to give you a better understanding of some things that the emergency providers are up against, as well as to bring on the governor today to talk about some of the things that we are doing at the state level to try to remedy some of these issues. So rest assured that folks in the allied healthcare professional realm are working hard to try to come up with innovative ideas to help us with the throughput of patients in the emergency department, to help reduce the amount of time that you have to wait and to make your conditions safer while we are there, and while you are there, I should say. And rest assured in knowing that the task force is working hard here in the state of Wisconsin, and we should be hearing at the end of this year, I want to say, and into 2025, what their findings are and their suggestions are for the state of Wisconsin, so that we can again push forward to retain our much needed nursing staff here in the state of Wisconsin. So with that being said, thank you so much again for joining us here today. I want to thank Governor Evers for coming out and speaking to us as well. We are going to continue to press on the issues that are affecting your health here in the state of Wisconsin, and we're going to continue to report on that and to give you some insight into what we are experiencing as a state and some of the ways out of it as well. I want you to continue to reach out. You can feel free to reach out to us at the Pulse Check Wisconsin website, like and subscribe to us on YouTube as well as X and Instagram. Please, please, please continue to give me your feedback. It has been very helpful thus far. We're going to continue to do the shortened episodes as well as the longer episodes with cases as well. That should resume. So stay tuned for that. We got some good guests up that are going to talk about more social determinants of health, as well as how your vote can really tailor your healthcare experience and how that contributes to some of the population health and public health as well. So stay tuned for that. Until that time, again, as always, take care of yourselves, take care of each other. And if you need me, come and see me.